sector lead, the healthcare sector lead in the British Embassy, and I'm really, really pleased to see you here. I'm very, very excited about the morning that we're going to have. Just a few logistical things. Please feel free to put your masks on, or everything is open. The windows are open, the doors are open. There's also air conditioning, but if you feel like uncomfortable, just please put your mask on or take your mask off. It's up to you. The other thing is there's still food and drink outside where you've just been. Feel free to have during the short breaks in between. We're going to have time for questions after each session, but very brief, like 1 or 2 questions after each session. And at the end of the last session, you're all invited for a quick light lunch outside, and we can continue networking and you can continue asking your questions. Now I'd like to welcome Ambassador Neil Wigan to say his opening words. Thank you.
אז בוקר טוב לכולם וברוכות הבאות, ואנחנו מאוד שמחים שסוף סוף אנחנו יכולים לחיות פה ביחד, לא רק בזום, אז אני מקווה שזה גם העתיד, והסוף של העברית שלי. זה מה יש, אני מצטער. So I am the least expert and the least qualified person in this room to talk about femtech, so I will get out of the way very quickly. But I did want to say 2 things. So the first, of course, is a big thank you. So I know events like this take a lot of work and a lot of organization, and we're really grateful to all the speakers, the moderators, the panelists and so on for giving up their time and contributing to this event. I don't want to make it too much of an Oscar speech, but I did want to make sure I don't forget some of the key people. First, I'd really like to thank the participants from the UK. So we hope that one thing that will make this event really useful for all of you is to hear direct from participants in the UK who have some experience in the femtech industry, from the NHS, from digital health, from startups, from venture capital companies, who can talk to you a little bit about the UK ecosystem. I also really wanted to thank Taylor Wessing, who are our core partners in the Embassy Venture Capital Club, which we set up. We think is a really useful way of bringing Israeli and British venture capital companies together. We see a lot of potential in that, which we haven't really exploited up to now. So I'd like to say a big thank you to them, in particular to Alexandra Richardson, who's a partner at Taylor Wessing, for coming along to the investor panel. Of course, a big thank you to the 3 moderators, so Dr. Daniela Cohen, Gali Weinreb, and Sam Cronin. Of course, many of you will know because he used to work at the embassy, so he's got to be particularly good and impressive today. No pressure, Sam. And then as well to Orit Alperovitz from NEOME, who has been a key partner for us on making this event be as useful and high impact as we hope it could possibly be. And lastly, a big thank you from me to Ronit and to all the team at the UK-Israel Tech Hub, who are now embarrassed enough to stand up and introduce themselves so you know who they are. So Ronit. Could you give a little bit more than just Idan? Modesty is great, but not too British.
My name is Sammy, and I'm a program manager at the UK-Israel.
And I'm Ella, I'm Deputy Director of the Tech.
Thanks. So this is the team on which I entirely rely, but a particular thank you to Ronit, who has really taken this event and run with it really quickly. So really grateful to the work that she has put in. And we're really pleased to do this event. We know that femtech is a really growing sector in the UK. I've heard direct from some of the companies in the sector in the UK, in Israel, and we know that the technology here is really excellent. But we also know it's a relatively new sector. It's a new investment sector as well in the Israeli tech market. And in the UK, there's a deeper investor market, there's a deeper ecosystem. So our idea was that we would hold this event today to try to help some of that experience from the UK to help with the growth of the sector here in Israel, because we see enormous potential. It's a very rapidly growing area. There's a huge amount of interest in it. And at the embassy, where we look at tech sectors where we want to work more closely with Israel and where we see a partnership between the UK and Israel, health generally is we see as one of the key sectors. And that's very much been proved through COVID. That's really increased both the level of cooperation between Israeli and British institutions at everything from the startup level through to the government level. And I think we see the way of using that to build up broader health collaboration between the UK and Israel, and Femtech as one of the rapidly growing areas as one of the particular subsectors that we can do that. So that's very much the idea behind this event around that specific issue. But then, of course, more broadly, we hope that this will play part of our work with the venture capital community in general, but building closer UK and Israel health tech links in general. So with that, I've done the classic ambassador thing of saying I'll speak for a short time, then talking for a long time. So I will get out of the way and let the experts carry on. Thank you very much.
Well, good morning. I think I will take the role of the Oscar speech now. So first of all, thank you, Mr. Ambassador, for hosting us at your residence. I will not repeat the opening notes and thanks mentioned by the Ambassador, but I would like to add huge thanks to the UK-Israel Tech Hub for partnering with me, and special thanks to Mrs. Ronit Appelbaum, who leads the healthcare space, whom together we brought this morning live. I would also like to thank our additional partners and sponsors, Altman Health, Procter & Gamble Ventures, McKinsey & Company, and Taylor Westing Law Firm. What do we know about women's body? Experiences like hormonal cycle, vaginal secretion, vaginal dryness, menopause, or even menstruation for long been taboos, unspoken, untouched areas, or simply ignored. Just in recent weeks, we could witness the public discussion about the effect COVID vaccination may have on menstruation. While the formal opinion is that such link is very difficult to conclude, I think the significant takeout is the understanding that this topic, which is very important and vital in women's physiology and fertility, was not checked so far as part of clinical trials. Moreover, for years, women were excluded from clinical trials, and women are at higher risk to be misdiagnosed or suffer from adverse reaction to drugs. We cannot avoid it. There is a huge gender data gap in medicine, but it is changing. Firstly, by women who are not willing to accept it any longer. Women pursue to improve their quality of life as well as longevity. For women today, femtech startups like those we will meet here today are filling in this void or gap. Secondly, we receive high indications from the UK and also from other markets for constant growth in demand, funding, and M&As in the femtech space. The extent is still limited, but we believe this is only marks the beginning. Femtech, as you will hear today, is more than fertility or reproductive apps, and it's certainly not a niche. It serves the half of the population. The gender data gap brings many new business and investment opportunities in a space that is still considered a blue ocean. NEOME, as the first female investment club in Israel, is very committed to support the growth of femtech. I hope this morning will be an eye-opening and will light a discussion on the unmet needs of women's health and will enhance the establishment on an effective femtech ecosystem and see more investors and other key players in the healthcare space joining NEOME. Thank you everyone for joining us, and I hope you enjoy our discussion today.
She should be sharing her screen any minute.
Well, thank you for having me today. I am very honored to be here with you, and I should have been with you in person in Israel, but as luck would have it, I have to be in Switzerland to speak about women's health. And so I'm joining you from Zurich in Switzerland. I'm very glad to be here. I'm a partner out of McKinsey's Tel Aviv office. Given this is the UK-Israel Tech Hub, I should mention that the Tel Aviv office is part of our UK-IIO cluster, UK, Ireland, and Israel. So this is like, you're all my family here. And I moved to Israel exactly 6 years ago. Tomorrow is my Aliyah-versary, as we call it. Before Israel, I spent 12 years in the US, in New York City and Chicago, and I'm originally from France, as you can hear from the accent. I grew up in Paris. I do all of my work in the healthcare space. I had the privilege of serving many players across the chain, such as hospital, pharmacy chains, but I have been much more focused on life science industry, supporting clients in strategy and commercialization. And I now lead the healthcare vertical of McKinsey's high-tech hub, which has the aspiration to serve innovators and high-growth companies in Israel and Europe, and for me in the UK, Ireland, and Israel in particular. So today I'm talking about women's health, and I've purposefully titled this dialogue, "It's Time to Talk About Women's Health," because the key message that I want to leave you with is that we are at an inflection point. Many factors are pointing to the fact that the timing to act is now. There are many attractive investment opportunities in women's health that will enable us to drive better health outcomes for women and for society at large. Before I start, I also want to acknowledge that not all people who identify as women are born biologically female and vice versa. So the focus of this presentation is on women's health support as a market segment specific to the female biological sex. And I recognize the need for future research that is more inclusive of transgender, non-binary, and gender fluid communities. And this is something we will explore as next steps. So as highlighted in recent books that many of you must have read, and if you haven't, you really should, books like Invisible Women, Doing Harm, Sex Matters, we can see that modern medicine was developed with male physiology as the default. The implication of doing research this way is that, as examples, women are 7 times more likely to be misdiagnosed or discharged during a heart attack. They're 50% more likely to die of a heart attack compared to men. And we see these inequities not only in research, but also in drug development, where women were excluded for a long time and are twice as likely to adverse events. And also in care delivery, where we see different even reimbursement rates in the US for the same procedure, male versus female. For too long, we've heard women's health referred to as a niche market. And so I want to ask, what characterizes a niche market? Certainly not, one would think, half the world's population. Women drive much of healthcare. They account for 80% of consumer purchasing decisions in healthcare. They represent 75% of healthcare industry workers, and they spend more than men in healthcare in most stages of their life. Investing in women's health is a win at all levels. We all know that healthier women will make for stronger economies and stronger societies. And beyond that, women's health has a cascading benefit because we know that women are often caretakers, and so it will have a positive effect on children and on the elderly. And it's also a win for business leaders because that's starting to change. Femtech is at the vanguard of driving growth, and investment in women's health is creating big opportunities for value creation and for societal impact. So women's health, in our definition, is much more than just reproduction. Our definition takes a very broad approach. When we consider women's health, we think about female-specific conditions, whether tied to women's reproduction system or other facets of women's biology, and the general conditions that affect women differently or disproportionately. The diagnosis, prevention, and treatment and the related products for these conditions are what we refer to as women's health. Largely female-specific conditions include, of course, reproduction, contraception, fertility, maternal health, also menopause. And female conditions also include gynecology, such as endometriosis, pelvic floor, menstruation, sexual health, and gynecological infection, such as bacterial vaginosis, HPV. And we also have in there women's oncology, which includes breast cancer, ovarian cancer, and cervical cancer. The general health conditions that we include and that are feeding into women's health are those which affect women differently, for example, cardiovascular diseases, or that affect women disproportionately, for example, autoimmune diseases, migraines, and osteoporosis. We also are including diseases or issues that are characterized by gender bias in care delivery, for example, pain or mental health. And here we also include conditions for which sex differences are not precisely known or understudied, but which evidence suggests affect women disproportionately. For example, Alzheimer's diseases would fall into this category. If you look at the current global innovation pipeline, you'll see a real mismatch between health investments versus health needs. This is a remarkable opportunity for investing in women's health and in female-specific conditions. In aggregate, if you look at how much is invested, female conditions outside of oncology, we've in purpose excluded oncology here because it is, an aspect that is looked at much more. You'll see that only 2% of the current healthcare pipeline is focused on women. And just to compare and contextualize, if you think about rheumatoid arthritis, you have 27 times more biopharma assets if you compare it to commensurate disability adjusted years, what we call DALYs. And hepatitis B would have 41 times more. It's even worse when you think about the true disparity, because entire categories in female conditions are completely omitted from disease burden measures. For example, not sure if you all know, but menopause and all of the associated symptoms are not captured in any global disease burden databases. So now new technologies are fueling waves of innovation in women's health. We're seeing life science technologies such as proteomics, tissue engineering, that can be applied to address what have long been poorly understood female-specific diseases. We also see women's access to care and quality of care being taken to the next level by consumer-oriented digital solution. And so could you imagine really that medicine, therapies, or devices would be less attuned to women in the coming years? I mean, an informed market would not allow this. And I think also our values as a caring and inclusive society will not allow this. So against this backdrop of unmet needs are also low historical investment by incumbent. And now comes Femtech. The term was first coined in 2016 by Ida Tin, and it includes a range of tech-enabled consumer-centric solutions. It's getting a lot of attention. It's powered to a remarkable extent by female entrepreneurs. Over 70% of the nearly 800 Femtech companies that we have analyzed at McKinsey had at least one female founder, compared to 20% average for other companies. So while it's still early days, we see trends are accelerating, and Femtech is really at the cusp of capturing enormous potential. Our definition of Femtech includes three elements. The first one is tech-enabled, consumer-centric, and that address women's most pressing healthcare needs. So what I'll share with you now are some of the findings from our research looking at those 800 companies that fit this definition. We see those Femtech companies disrupting the traditional healthcare in multiple ways. First, care delivery. We're seeing virtual clinics, innovative brick and mortar clinics, and direct-to-consumer prescription delivery services. All of this is allowing women to access care in a more convenient and more consumer-friendly way. Second, it's self-care. Trackers, wearables, at-home diagnostics. Those are the solutions that empower women to take charge of their own health and the related health data. Third, it's unlocking life science innovation, clinical diagnostic, tools companies that are pushing the scientific frontier to address unmet needs in areas such as endometriosis or preterm birth. Fourth, is that it addresses stigmatized care. Companies are now addressing topics that have been stigmatized for a long time, and they're doing that head on, like menstrual health, sexual health, pelvic care, menopause. And lastly, we think Femtech will help ensure that care is delivered in a culturally competent and tailored way. Solutions are being tailored for subpopulation, like Black women, LGBTQ population, women in low and middle income countries. Now, these categories are already multiplying, and they're also starting to blur, as exactly one would expect, as Femtech companies begin to scale and consider how to expand upstream or downstream in the reproductive life cycle. Some businesses are launched on a direct-to-consumer model, and then they seek reimbursement and regulatory approval. And so they're building upon this experience and real-world data. We think that looking forward, there are also opportunities for entrepreneurs to expand deeper into white spaces, to tackle general health conditions, or to specifically address the need of underserved population. Now, we're seeing this exponential growth in Femtech interest everywhere. You can see on the left side here, what we call public awareness, which is the number of articles on the topic. And you can see on the right side, the number of companies funded is surging. And this is also leading to more awareness. More importantly, we're also seeing funding really going through the roof. And the first breakthroughs are already underway. Several companies, you've heard of Progeny, Maven, they're already valued at over $1 billion. Their projected forecasts are showing double-digit revenue growth in Femtech. When you look across digital health, Femtech companies only receive 3% of digital health funding. So there is much more room for growth. And there's the opportunities for multiple players like investors, researchers, payers, pharmaceutical, medical device companies are really substantial. One thing that's worth mentioning is that in parallel, we're seeing large players in traditional sectors entering the space. So for example, the cosmetic leader L'Oreal that recently unveiled partnership with Clue to deepen the knowledge on the relationship between skin health and the menstrual cycle. Apple, Apple's health team has hired an OBGYN, Dr. Kristen Curry. They're looking at how the company can bolster the effort into women's health. They also started a partnership with Harvard and made women's health a strategic priority. And when you think about that sort of cross-pollination, it reminds us of the scale of reimagination and investment that happened in other sectors, like, for example, mobility or fintech. More than $400 billion were invested in the last decade in mobility technology companies. And the overwhelming proportion came from non-legacy automotive companies. So we're, as Femtech companies increasingly gain traction and change the competitive landscape, we think stakeholders within and beyond the healthcare system will take notice, and that could propel Femtech even further. So where are people investing? In our scan of 800 companies, we found a concentration in maternal health and consumer menstrual products, and gynecological devices, and infertility solutions. But there are many significant white spaces, like menopause, for example, and they're significantly underinvested by legacy pharmaco, device players, and by Femtech entrepreneurs alike. So there's still a lot of opportunity for entrepreneurs and for investors. So looking ahead, we see 5 areas of focus to drive more equitable and inclusive healthcare for women, and to unlock, meaningful business opportunity, of course. The first one is sex and gender-aware research. Both industry and academia can strive to do more of this, from burden measurement to basic research, with sex as a biological variable, and development of diagnostics and therapeutics. And by the way, taking account of sex differences makes for healthier men as well, because diagnosis, dosages, treatments, devices should be aimed not at an average or modified male default, but at sex-specific physiology at all levels. Investment in white space opportunity. We think that established players and distributors alike can accelerate investment, particularly by allocating resources to women's health conditions that have few or no existing therapies. Gender-aware care delivery. We think providers can increasingly incorporate sex and gender-aware elements into disease diagnosis, prevention, treatment. Payers could also seek to reimburse women's health procedures on par with men's to attract commensurate interest in achieving better health outcomes from everyone. We also think we could engage women more as the primary healthcare consumer. Women are the primary healthcare decision makers for themselves, often for their families, and they spend more on healthcare than men. We know also that it will give them a better experience, and in turn, they could help earn greater market share. And lastly, of course, greater diversity and inclusion across the value chain. Increasing female representation among researchers, inventors, investors, founders will ensure that more solutions are targeting women's health. And we hope that this will also help the development come to fruition. Research has shown that when inventors set out to solve health problems, male inventors are more likely to solve for a more oriented male condition, and women-led actually solve for both. So we believe that more women inventors, investors, and physicians will actually not mean healthier women only, but it will mean more people solving for the health conditions of all human beings. So I want to thank you for having me here. It was a great honor to start this day. I look forward to continuing this conversation and talk about how we can capture the opportunity. I think improving the health of women is good for us all. Like I said multiple times, if you play the dynamic of women's health forward, we can see massive societal benefits. And we are headed for an inflection point, one of the happier development in medical history, one can argue, because we have more data, more technology, and better understanding of biological differences. So I really see enormous opportunity in the near future, and I really look forward to the rest of the discussion today and hearing from you as well.
Thank you, Gila. We think we have time for one, maybe two questions from the audience, if you'd like to ask Gila before she disappears into the Zoom. Anyone? Okay. Oh, sorry.
Gila, thank you so much for sharing the insightful research. And I think it's well needed to make a point and prove that there's an huge opportunity here. I'm curious about the difference, especially as reflected in your research, between global North and global South. I think often research misses global South. It's very common. And is there a difference in what you're finding, and how much is reflected in Femtech in the global South? Is there attention being paid there? What's the need? What might be the differences, if any of that was found in the research? Thanks.
Yeah, it's a very interesting question. Thank you so much. So I don't have numbers specific to this, but I can tell you from anecdotal evidence more that we're actually seeing something very interesting with digital health in general, which is that we had much more innovation in the classic innovation. It always comes from the North and goes to the South. And here we're seeing something different. We're seeing some innovation coming from the South and moving to the North, because people are trying to solve the issues of the South, for example, through telemedicine or remote care delivery, and then realizing that these solutions are needed also in the North. So for example, in the US, Medicaid has set up a fund that is specifically looking at bringing innovation that was developed for the global South to the United States for the communities that are underserved. which is pretty innovative in a sense, right? This reverse innovation piece. And we're finding this very interesting. I don't know yet where this is going to go. I'm still looking at it. I think one key point that we're trying to bring up, though, is that when people think about health equity, which we believe gender equity is a part of, people very naturally go to global south versus global north. And I'm really trying to emphasize in my work that even within the global north, we have a lot of inequities, meaning that, you know, some folks still view working on equity as, you know, maybe more of a corporate social responsibility, but you shouldn't view it just like this, right? You have a lot to gain by addressing inequities, even within the global north. There's so much opportunity to reduce those inequities, and it makes also financial sense. So I really want to see pharma companies and investors and founders move towards understanding that addressing health inequities is also a driver for growth for themselves. It's not just the right thing to do.
There's also a question in the chat, Gila, if you can have a look from Jenny Thomas from London. I don't have the computer in front of me here. If you can.
So if you could pick out one driver, what do you think could make the biggest difference to accelerate the benefit of femtech and women? So right now, I think we need, it's almost like, what are the foundations? And I mentioned, 5 things that we could do, but I think the real foundation is sex and gender aware research, because it's the basis for a lot of innovation. I think we're missing data, to be honest. And it's hard to get people moving when you don't have a clear, burning platform. And I'm embarrassed to say that sometimes I speak with, very smart people, colleague of mine, right? And they don't see the problem even, right? And so I still feel like we need to build this burning platform, so that it also, again, is not, we're not doing women's health because it's the right thing to do, because it's gender equity, blah, 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 but because it makes sense for everyone, right?
Okay, thank you.
Is there a question from Jaren? I see a hand up if we have time.
I think we don't have time, unfortunately, but thank you so much for being so flexible and coming to this event. And we'd like to call the next panel, please. If you want in the meantime to have a coffee or anything, please do, but we'll set up the next panel. Thank you, Gila.
Okay, hi, good morning, everyone. Pleasure to be here. Thanks for inviting us. My name is Daniela Cohen. I'm a family physician at Maccabi Healthcare Services, and I'm also the director of the community medicine department at Maccabi. And in addition, I'm also a GP working at the UK a few times a year. I studied actually at University College London. I did my medical school there, and I love to continue working occasionally in the UK. It gives me a really good perspective. And I'm really happy to host the panel this morning with my wonderful guests and to talk a little bit about the gap and opportunities that Femtech presents, and to give you a bit of a perspective from the ground. Okay, so I know you'll have a lot of speakers later on focusing exactly on the tech, but actually the tech needs to provide solutions for needs, and hopefully we'll discuss that this morning. So I'm going to let each of my panelists introduce themselves. We'll start with Leo.
Hi, good morning. Thank you for this event and this panel. I am Dr. Lior Baruch. I'm a family physician and the founder and manager of Healthy Hair, Feminist Medicine. We're a nonprofit organization, and we promote a feminist approach to medicine. And specifically, we address inequalities that affect women and the LGBTQ community.
Hi, good morning, everybody. I'm Dr. Itamar Netzer. I'm an OBGYN and medical administrator in Clalit Healthcare Services.
Hi, everybody. Thank you for inviting us to be here. I'm Ronelle Klingman. I am a family physician And I'm here in my capacity as co-founder of NOGAFEM, which is a non-for-profit organization that looks at incorporating sex and gender into healthcare research and technologies.
Sorry, and we have Jenny from the UK, Jenny Thomas. If you could.
Hey, everyone.
Sorry, we
I'm
don't see you yet. We can't see
Okay.
you.
I think probably everyone.
They're working on it. Oh, there she is. Hi, Jenny. Hi.
Hey, nice and big. Hi, everyone. I'm Jenny Thomas. I run an organization called Digital Health London in the UK, and I have a background in digital health, but also women's health. In terms of Digital Health London, probably if you have heard of us, it's because of our accelerator, which I led the setup of in 2016. But I also have experience of women's health. Many years ago, I was the general manager for women's at Guy's and St Thomas's Hospital in the UK. And I've also conducted research and worked in both Tamil Nadu in India and also the Gambia in West Africa in relation to women's health. It's a topic I'm extremely passionate about. And when it comes to femtech or perhaps women plus digital health in the UK, I'm certainly someone that's got a lot to say about it.
Thank you, Jenny. Okay, so we'll dive in. Ronelle, I'll address this question to you first. Following Gila's presentation, which was really very illuminating and focused on the importance of women's health and how it's underserved in a way in its focus, still, some people would argue that there's a lot of research regarding the classic women's health issues, which are pregnancy, fertility, etc., but that anyway, women's needs are addressed as part of the general medical studies and medical innovations. So why do we actually need a separate femtech category? What's the added value in that, in defining it as such?
So I think, first of all, part of our work at NOGAFEM is really highlighting the fact that some differences that we see between men and women actually underlie hidden mechanisms that were not studied before. And the approach to women's health really needs to form a broader lens in terms of addressing chronic diseases that are disproportionate in women, like autoimmune diseases, or present differently in women. And these cannot be, these are not niched into conditions that specifically affect women. Cardiovascular disease affects men and women almost equally. And yet we know that we have the same organ and the same vessels, and yet the whole way that the cardiovascular system functions in women is different. And I think that there are huge areas of unmet need, firstly in terms of areas that have just been understudied, and therefore we lack innovation because we really feel that research is the driver for innovation. And if we don't sex disaggregate data and we don't incorporate gender into our data, we cannot really provide optimal care at the ground roots level to women. And I think the other thing that's so important about this space is that we need to incorporate that into the technological innovations that we see. Apps that take a male-centric model and try and apply it to women may not provide the outcome that women need. Let's just take cardiovascular disease as an example. We almost really need to re-look the whole cardiovascular disease risk assessment in terms of women. They have endothelial dysfunction. We need to bring in markers for that. We have this outstanding proteomics, genomics that can look at specific biomarkers in women that perhaps are not present in men. I think these are all ways in which technology companies might have even established their technologies, but just need to maybe tweak them or change them to benefit women so that we can offer personalized and optimal care. Thank you.
Okay, thank you very much. Itamar, historically, women's health has been studied, as we heard also from Gila and now from Ronelle, hasn't been studied really very much in particular. We've seen that even with the COVID vaccine, that it was taken as one cohort and they didn't really particularly say anything about women. And we've heard, perhaps everyone has heard, all kinds of reports about effects of the vaccine on menstruation, etc. If they're based or not, we don't really know because the research wasn't done in particular around that area. So how would you say HMOs and hospitals, how do they address these issues of women's health?
Thank you for that question. Is this on? Thank you very much. Is it talking now? Yes, take this on. So there's clearly a deficit both in information and in knowledge and skills, and I'm talking mostly about physicians. Whether you look at clinicians or researchers, we know there's a big lacuna that is not addressed about women's health. And obviously, I'm stating the obvious here. We all know this, and we've heard about cardiovascular effects, and you've mentioned how all of the studies about COVID vaccines did not take into account the things that actually bother women more than the question of fertility. For example, we know there was a big fertility health scare concerning the vaccine, and that has been researched because that's obviously something very important. But there has not been sufficient research about menstrual irregularities, disorders. Do they exist or not? What kind of effect do they have? Nobody has thought about how this will affect uptake of the vaccine. And this is clearly something that affects uptake both for adults and now for the pediatric population. And this is indicative of the state of affairs everywhere, more or less. And if you look at providers, insurers, and hospitals right now, we see that there are not a lot of programs in effect that specifically address women's needs. And of course, I'm not talking about just gynecology, but all of the various aspects of women's life and life cycle, which are not addressed specifically. And doctors are usually not well aware of gender medicine or not aware enough. They have heard of it, but they do not receive the training that is necessary. Lastly, I would say that reimbursement, at least in Israel, falls short. And there is no specific reimbursement that addresses women's health or women's health needs. And so this is an area where digital medicine and medtech companies can come in and provide solutions that do not require a specific reimbursement from the government or from insurers and add more value to this equation.
Thank you. Thank you for that. Jenny, I'd love to bring you into the discussion, and perhaps you can give us a bit of an overview as to what is on offer in terms of apps, in terms of services in the NHS in the UK around this area.
Yeah, certainly. What I would say is that there actually are quite a lot of things that are happening in the NHS in the UK. I wouldn't say that there was a kind of top-down strategy when it comes to femtech and the adoption of different solutions. But when you kind of look into it and you look at different organizations, there are great examples. So the accelerator that we run at Digital Health London, there's a company called Pepe Health that support people, but particularly women going through life transitions like the menopause or becoming a parent for the first time or going through a fertility journey. And they've, over the course of the last year, been adopted by about 6 NHS trusts, which is fantastic. And that support has particularly focused on actually helping staff within the NHS who are going through the menopause. But there are also examples of where they've directly supported patients, particularly in Manchester. And that was something that kicked off during the pandemic. There's also a number of other apps and things out there that are in small different organizations.
Jenny, sorry, we missed quite a bit of what you said. We had a technical problem, sorry.
Okay. I don't know whether people heard that virtually, but I was giving an example of one company that's been supported by the Digital Health London Accelerator this year, Pepe Health. And that's a company that's supporting particularly women going through life transitions. And the support they give to women going through the menopause has been adopted by a number of NHS trusts in the past year to support NHS staff, which is fantastic. And also the support they give to first-time parents, that's been particularly tested in a trust in Manchester and shown benefits, which I think what's really interesting about Pepe is they demonstrate that actually solutions can reduce health inequalities. There's often quite a lot of concern for fair reason that in the UK, as I'm sure it is elsewhere in the world, that digital health can create a two-tier health service. But I think Pepe is a great example where actually there's evidence that the solution is reducing health inequalities. So improving breastfeeding rates, particularly amongst Black and brown mums, and also supporting families from lower socioeconomic groups, which is really, really fantastic. And they've got some good outcome metrics with respect to the impact it has on the mental health of first-time mums. So there are examples in the UK like that, which is great, but there's a lot more to do.
Okay, thanks a lot. Thank you. So, Lior, if we also take into account the fact that you're a family physician in an HMO at Maccabi, can you give us some ideas as what hospitals or actually HMOs can do to further Femtech, to further our focus on these issues?
I think that we can incorporate sex and gender medicine and aspects of women's health in HMOs. You probably know, but my proposal to Maccabi, the second largest HMO in Israel, was to set a center for a virtual consultation center for primary care physicians that can have consultation about sex and gender medicine issues that they see in everyday practice. Because we know that there are a few experts that have the knowledge, we have the theory, but we have problem implementing it right now. So if we set this virtual consultation center, then we can make it more accessible to the physicians in the community.
Thank you. I'll just say that Lior and I had a few conversations about this virtual consultation possibility. We already have the facility in Maccabi, maybe in the Clalit, that you can virtually consult with a variety of physicians of different specialties. But no one thought of the gender, the possibility of asking questions surrounding gender issues that aren't to a gynecologist, just other things that might be related to cardiology, to medication, to to side effects, all these other things, and hopefully we'll be addressing that. But part of what we need to do also, I think, is education, and we have to educate our physicians. We have no clue that there is this huge area of medicine that we haven't really looked at. So I think that's really part of what we're going to do as we approach this. I'll just add another issue that we did discuss, or at least in Maccabi we're thinking about, for example, is menopause clinics. We don't have menopause clinics. I don't know, Itamar, if you have.
No, we don't have designated clinics for that.
Okay, so COVID allowing, because all the times our plans change because of COVID, but hopefully in 2022, that's one of the things we're going to look at. Menopause is a huge issue. Almost every woman passes through it and has some symptoms usually related to it, and we're not addressing that properly. So that's another thing we're looking into. So definitely the whole area of women's health from different aspects is coming into the HMOs as well, and we're starting to focus on them. So I'll just move on a little bit, and we did discuss COVID, we touched on COVID, and throughout COVID, of course, telemedicine received center stage, and it became one of the major tools through which we practice medicine. And Itamar, I'd like you to just perhaps say a few words about how you think that might impact women from a perspective we haven't thought about before.
Thank you for the question. Well, the accessibility issue for men and women in telemedicine is quite different. It's, at least in some cases, when we think about providing hybrid consultations or telemedical consultations, the accessibility for men and women may be completely different, not just in terms of our more weakened societies where women have less access, but also in terms of women seeking help for domestic violence or for their own other personal problems, where they do not have the privacy to engage in a really beneficial telemedical consultations. So in many places, women are still burdened with childcare more than the men are. They lack the facilities for private consultations. They might need to divulge sensitive information to their physician. And this is something that we found that men have experienced less. So it has put more of a stress and more of a problem of equity for women who wish to partake with telemedical consultations.
Thank you.
Actually, I don't have a statistic about that question, so I wouldn't want to guess. But we do know that there have been complaints and specific problems with women who have not been able to enjoy telemedical services because they could not have the facilities that the men in the same household would probably have.
Thank you. Jenny, I'd love to hear your perspective on that question as well from the UK.
Yeah, sure. I mean, I think that there's been positives and negatives. So I mean, certainly as a mum myself, 2 kids, the convenience of being able to have, appointments with my GP, video appointments is huge, and be able to kind of get things done. But then I think because of the backlog and the waiting times, there's also perhaps particular challenges for women or whoever kind of takes on that care giving role in a family, that actually it's more difficult to, perhaps if you can't make an appointment, then being able to reschedule it, you might not get another appointment for quite a long time. So that could put increased pressure on women. I think not in terms of, I guess, sort of companies, femtech companies, but talking to staff within the NHS, particularly midwifery leaders, there's been a real benefit in just being able to use, what we're using today, Zoom, to be able to access and get feedback from a more diverse group of women when thinking about kind of maternity services or gynecology services, in terms of, what are the things that are good, what are the things that need to be developed. And I think in the past, in the UK, certainly, I remember when I was a general manager of the women's department, we used to have a maternity user group, but actually it was often quite challenging to interact with women, particularly if we were expecting them to come into the hospital and they've got children and other commitments. But actually being able to do it on Zoom, you can get really good feedback. So I think there's been some real benefits, but just as we've already heard, there's also challenges around safeguarding in terms of domestic violence, and really being aware. I'm having to do quite a lot of, obviously, training as well with staff to kind of think about those things, those different types of consultations. It's not just about the impact it has on women, but also staff themselves and the training that they might need to kind of think about that different consultation. So I think there's been pros and cons, so benefits, making it easier for women, but also perhaps a number of challenges as well.
Yeah, definitely. It's a new era. Ronelle, how do you think then that femtech might change things? Any ideas?
Well, I think originally it already has changed things. I think in terms of broadening people's perspectives and increasing people's education and awareness through all the advocacy that has been going on around the importance of raising these conversations and mainstreaming these conversations so that all women's health issues are seen as a natural progression of part of healthcare and part of innovation. And it's not kind of seen as a separate issue. And I think that, there are many companies that are starting to address the fragmentation of care by trying to get a more holistic approach to a woman and her lifespan. And we're even seeing that a woman may face certain stress tests in her life that may precipitate other diseases. So it's not while, she may go through her reproductive life and then her perimenopause, these are areas where her specific biology and physiology then changes the whole dynamic about other diseases that may come to the fore. So I think we're definitely seeing the recognition and the awareness, and we're also starting to see the fact or the impact of research pushing innovation forward. Having said that, I still don't think that there's enough that's being done. I think menopause, just as you raised, is a space that has had a dearth of innovation up until now, and it's changing worldwide. We'd like to see a change in Israel more, seeing we have such amazing people able to develop technologies. But again, it's starting to change, and it needs to happen faster.
Thank you. And Leo, the same question to you.
I agree with Ronel, of course. I also think that Femtech has the liberty to approach problems in a more creative way sometimes. I want to give an example that is not reproductive health. It's the vaginal ring that prevents HIV infection. That's a silicone ring, a thing that we already have because there's a contraception ring. And women in endemic places figured that we can use this ring to administer other drugs. So there's a silicone ring that women can insert vaginally on their own, no healthcare provider needed. And it releases continuously 2 antiretroviral drugs. So that's a great thing. That's a great example because it takes into consideration the female biology, but also sees the real life barriers that women face. Especially in endemic places, women can be in danger of rape. They're not always can rely on their partner being HIV negative or HIV undetectable. Sometimes they're just in survival mode and can't adhere to a regime of 1 pill a day. So this ring, it releases, you only need to change it every 28 days. It gives them much more freedom, control over their health. It can even be hidden. So that's something that sad to say, but sometimes is needed. And this was women initiated, you know, thing. Exactly, thank you. So I think that this is exactly the greatness of Femtech.
Thank you. That's actually a really, really good example, and it shows how a need drives innovation. So thank you for that. I think we're out of time. Maybe one question, if anyone has a question for the panel. No question? Oh, yeah. Well, I agree. It's been a while since I was in medical school, so maybe Leo could answer that.
Actually, I finished medical school only 10 years ago, and we never we never heard a thing about sex and gender medicine, so that's kind of sad. But now in Healthy Hair, this is one of the things that we do. We go to medical schools and we teach students from the very beginning not only women's health but also LGBTQ health, and also continuous medical education for healthcare providers.
Right, so just following in Buz's question, I've also graduated a long time ago, but luckily I found that the Israeli Society for Gender Medicine is mostly run by female students, or it was mostly dominated by medical students, showing that there is not institutional awareness, but certainly the students themselves are smart enough to know that there's more that needs to be done, and I think that that is very hopeful.
Sorry, we don't have time. I'm really sorry. I don't know if during lunch, we'll pick it up. Thank you so much. Thank you for all the panelists. Thank you.
Hello, everybody. I want to thank the ambassador and the British Embassy for hosting us, to thank Ronit Appelbaum and Norit Alperovich for organizing this awesome event, and for the opportunity to present the work we're doing at the Sheba Women's Health Innovation Center. I'm Avi. I'm a physician, an OBGYN expert. I spend most of my time following women with high-risk pregnancy, running the ultrasound anatomy survey, and of course in the labor and delivery ward. In addition, This week, we are launching the first OBGYN Beyond department. It will be an OBGYN department dedicated to telemedicine. And I'm the founder and director of the Sheba Women's Health Innovation Center. And today I want to take the opportunity to describe our efforts transforming women's healthcare. So the Sheba Women's Health Innovation Center is a collaborative effort of the following excellent centers of Sheba. First and foremost, ARC and its innovation hubs, contributing our digital excellence in artificial intelligence, virtual reality, and precision medicine. Then Sheba Beyond, as described, establishing the first OBGYN Beyond department. Gertner Institute contributing their excellence in epidemiology and health policy. Our Department of Obstetrics and Gynecology contributing our understanding of the major unmet needs. And of course, and that's the reason I came here today, our collaborators in the industry, which we are seeking to strengthen collaborations with. So, although I agree with all said in Gila's presentation about the Femtech inflection, in this study of Dr. Klang and myself, you can observe that we compared, the blue line is depicts OBGYN. We compared publications in PubMed of innovation themes, AI, telemedicine, augmented reality, microbiome. And as you can see, OBGYN is lagging way behind all other disciplines. And actually, there's no way I can put it in one graph, but there's a big difference between the OBGYN scientific dedication for innovation and what we see in industry. So as said, one opportunity we identified to catch up is telemedicine. We just completed the first pilot, and in 2 weeks, we are launching it as a service for women with gestational diabetes, leveraging state-of-the-art technologies such as Pulse-Mo for ultrasound, Heramed and Nuvo for fetal monitoring, Healthy.io for the urine dipstick. Our unique app we developed together with Datos for pregnancy follow-up, and additional technologies. We will be providing comprehensive remote care for women with gestational diabetes at home. The next year is going to be full with many pilots and trying to lead the digital transformation through the journey of fertility and pregnancy, starting with data-driven and remote care solutions for fertility, through data-driven solutions for pregnancy risk assessment, AI for imaging, maternal and fetal remote care assessment, our efforts for smart L&D, smart labor and delivery ward, including VR for pain management, and of course, the unmet need of postpartum and the digital solutions for lactation. Together with our strong work with the industry, trying to integrate into our clinical flow technologies others have developed, we try to translate the unmet needs we observe for our unique IP or contribution to women's healthcare, starting with this is actually Pregnantech is a device Pregnantech is a company commercializing a device I invented during my residency for preventing preterm birth. We have Birth AI, our AI platform for labor and delivery ward, which is free for use for women and pregnancy providers. And our hope is in the next year, and one of the potential co-founders is here in the room, to establish a new platform for menopause. So these are our activities. And as mentioned, we are seeking partners for innovation in women's health. And this is my mail, and I'm happy to be in touch for whoever is interested. Any time for questions?
I do have a question. It's actually a spillover from the previous conversation. As an entrepreneur working in the space of wellness and sexual wellness, we are collecting actually a lot of data, and we're also seeing that women have a tendency to sexual wellness to speak to non-doctors versus doctors, and it's a whole other discussion. And this is to you, and also to you, how can we form or forge alliances so that you can use the data that we're collecting? We're collecting a lot of data on painful sex mainly, and we're not seeing collaboration from the medical side in terms of sort of picking up this data and adding it to their analytic engines. So if we talked about menopause and menopause clinics, what we've seen in the past year is that there is, for instance, on our website, we have one button to speak with us and one button to speak to a doctor. And it's about a 20-to-1 ratio. 20 people will speak to us and one will speak to a doctor because women are uncomfortable speaking about it. They're not educated or they don't know what's changing. They don't know the role of estrogen. And we are seeking a collaboration with the doctors because we're getting this information. We're hearing these women because we're in the wellness space and not in the health space. And so there's a conversation going on. So how do you foresee your clinic working with us, collaborating with us? We would be happy to.
So first, it sounds like we need to continue this discussion offline, but I would say that we do observe with remote care, and it's starting with clinical disciplines. You know, currently, when you take a high-risk pregnancy clinic, so I follow a patient, sometimes she needs to see also a hematologist or an oncologist. So usually she would be going to me in the morning and then to the hematologist in the afternoon, and then in the best case, we chat. Now with a telemedicine platform, we are able to put all physicians together in one visit. And I think actually the example you gave is a great opportunity to put together more than only clinical caregivers, but actually other support women can receive.
So hello, everybody, and welcome to the Femtech Entrepreneur Panel. Today, we're going to meet the people who are actually on the ground running to change women's lives all over the world. We're going to hear about amazing technologies that are really like stretching the boundaries of healthcare, not just Femtech, but healthcare in general. So we have with us from Israel, we have Beatrice Chemla, who is the co-founder and CEO of Pepe Health. We have Inbal Tzafir Levi, who is the CEO and co-founder of GeneLife. We have Avi, who you met before, and Nimrod Lev, who is the co-founder and CEO of Gene Tools. Very interesting company. And we have joining us from the UK, will be joining. We have Chantel Bell, CEO and co-founder of Sirona Health, and Helen Guillaume, who is the founder and CEO of Wild AI. So maybe we can begin with each of you. Oh, now I see you. Okay, so maybe we can begin with each of you introducing briefly your company, and also if you can say during the introduction what your company is doing to bridge the data gap that we heard about before, the gender data gap. Okay, so if you want to start like that.
Good noon. Nimrod Lev, co-founder and CEO at Gene Tools. We are providing Genie, the first multi-causal, cost-effective and accurate system for diagnosis of vaginitis, which is the most common feminine condition, which is diagnosed today or misdiagnosed today in about 50% of first clinic visits.
Hi, I'm Beatrice Chemla from EMA, CEO and co-founder. At EMA, we are focused first on the fertility journey, and we are building a device, ultrasound, ultra-portable device, plus a platform to allow women to perform their own intravaginal scans from home. So the first vertical is for IVF because they are using the monitoring from home, but there are many, many other indications all along the women's health. So we are collecting a lot of data.
Hello, everyone. It's a pleasure being here. My name is Inbal, CEO and co-founder of GeneLife. We're developing early detection capabilities in women's health space. The first indication is ovarian cancer, will be followed by endometriosis. And what we're doing to bridge the data gap is that we're studying vaginal secretions, and we believe that this biofluid hasn't been getting the right or enough attention that it needs to, and it has a lot of data in it. So I'll be happy to share more. Thank you.
Avitso from the Sheba Women's Health Innovation Center. I hope you still remember me.
Okay, and Chantal and Helen?
Hi, I'm Helen, the founder and CEO of Wild AI, and we're doing research on the female body to understand what the woman needs and when. And we translate that research into an app, helping women who are active, eat, exercise, and recover with their physiology, whether they menstruate, use birth control, or are in perimenopause. So it's basically an app that you use on a day-to-day basis. We collect a lot of data from wearables and manual input on a daily basis. So we have data such as resting heart rate variability, sleep patterns, if you are menstruate, where you menstruate, where you are in the menstrual cycle, or symptoms if you are, for instance, in menopause and perimenopause, and how you react to the recommendations. So it's a self-reinforcement loop of learning to be able to help women on a daily basis.
Okay, Chantal?
Hi, everyone. My name is Chantal Bell. I'm one of the co-founders of Serona Health. Serona is a digital health platform providing, employee benefits to support women going through different life transitions throughout their life. We focus on various chronic gynae conditions such as endometriosis, PCOS, and menopause.
Great. So my first question is to Chantal and Helen, so we can get your international perspective. When you set out to raise money for your companies, did you feel that you had any challenges that were specific to Femtech in meeting your potential investors?
So I guess it's important to know like who we're talking to, and people are not necessarily interested if they don't think it applies to them, and that's definitely a reaction for sure. So very often, now it's a little bit different, but like probably 4 or 5 years ago, it was very different. Men would say like it's not that interesting, and maybe it's interesting for their wife, but for them definitely not. And they didn't really see the opportunity of basically serving a market that has been entirely underserved. So it's really a blue ocean market. Like we know 80% of the medical research today is done on males. And when it comes to sports, 46% of budgets only go to women. So if you see a market like that, which is like basically half of the world population who is underserved, who has money, spends money, and is craving solutions, if you don't see that as a money opportunity, it's a miss. But definitely that was one of the reactions. But that is not true for everyone. So I guess men who have daughters, interestingly, like although they may have a female partner, they didn't see that she was going through pains and discomforts, because women have learned to ignore their bodies. Like when you're a teenage girl and you have pain and you're bleeding, you are asked to run around like the other kids at school and sports. So really what we hear and learn as women is to ignore our body. So as a male partner, often they didn't see that in their female partner, but when they see their teenage girl going through changes and pains, suddenly they start to be interested. So I think I definitely saw that. So males who have daughters are interested, and women as well, and then some other men as well who just really realize it is a massive opportunity, business opportunity.
Interesting. It's not the first time that I've heard about women's issues only actually being accepted by men who have daughters. It's also about women managers, and it's interesting that they have wives, but it actually happens when they have daughters. I wonder what explains that. Chantal, do you want to say what your experience was?
Yeah, no, absolutely. I completely agree with what Helen said there, but also just to add, I think even between women, we don't always discuss, a lot of these issues we have. So sometimes the issue doesn't seem as grand as it could be. So sometimes you come across, you're on an investor meeting and you come across people who, for example, may not believe that the problem is as big as you say it is. For example, endometriosis, 10% of the population, same for PCOS, and 30% of women are going through menopause. But because it's not one of these daily conversations we're having, it doesn't seem as impactful as it actually is in reality. So trying to convey that is difficult, but I do think that the world is changing, and I do see that conversations are and people are believing the issue now, and I do think it's now about what solutions are best addressed to solve those issues.
Okay, and in Beth, did you have the same experience in Israel, and when going as an Israeli abroad?
Yes, so being a woman talking about vaginal secretions in front of men is at first not that easy, but as soon as people understand the huge unmet need in women's diagnostics in ovarian cancer, which kills tens of thousands of women every year, then the whole issue becomes a minor issue, and people are focused on the science, on the business model. And you know what? Many people have lost their dear women, daughters, aunts, mothers for ovarian cancer, and we're here to solve it. So yes, at first it's uncomfortable, but when reaching to the point when we need to understand the unmet need, it's obvious.
And Nimrod, did you have a different experience when you're presenting this as a man? I mean, it could go in different ways.
Yeah, actually a worse experience, because as a man, they can say, how can you tell? How can you know how women suffer, and what do you have to say about it? And well, lucky for me, my sister, Professor Achinoam Lev-Sagi, is a well-known physician in this area. So I got her as a fantastic help and as an advocate. Anyhow, indeed, when we enter the business size and the staggering numbers that we can present on half of the population of the world that suffers from these diseases, it makes sense, and nobody question more about gender or me being a man in a female arena.
And I wanted to ask Avi, you meet a lot of companies and many technologies that are going to become companies. And I'm wondering, how do you define the area of femtech? Is it everything that has to do with women's health and wellness, or is it a more narrow definition?
So personally, I don't seek to define what femtech is for the industry or for the VCs or for women. I tell you what are our priorities. As a hospital-based women's health innovation center, we are seeking clinical impact. So if there's a company developing a solution for cardiology, focusing on gender-specific treatment, it's clinical impact. If there's a company trying to develop a solution, changing behavior for a clinical goal, improving weight for PCOS, etc., it is clinical impact. If it's a solution for only well-being without a clear clinical impact, it could be a great investment, it could be a great company. Our ability to contribute here is not the same.
Okay, I wanted to ask Beatrice and also Helen. We know that some of the reason that the femtech market is now succeeding is because it managed to bypass the traditional players in the market through these technological advancements and go direct to the consumer, the female consumer. And I'm wondering if your business model takes that into account, and how did you decide if you want the payer to be an insurance company where most of the money is, or if you're going direct to consumer, and what your thinking was when deciding this?
So about our business model, we thought a lot about that. And first of all, we have to decide if we want to go directly to consumers, to women, or to go to physicians first or clinics. We first decided to go for first clinics because our IVF is something very medical, and we want this to stay under the control of a doctor. So that's a service, but it's not a device. We don't want to sell device, but that's a service that we want to offer to IVF clinics. But of course, women will benefit from it. And there's a part of the service that will be directly bought by the woman, because there is a part of a device that will be bought by the woman. So it's both, in fact. It's sell to IVF clinics, and that's very important, but there is a part that will be bought by the woman as well. So it's both. And in terms of, as you're saying about payers, we don't change, the flow. It says that, for example, if the clinics, they charge a scan for the IVF process, the same way, we won't change anything here in this process. We don't want, to disturb. So it's exactly the same way. So that's the way we thought the process. And last point is that we are really focused on cost. We really want that, if you imagine an ultrasound device which has to be small, usually, ultrasound devices are somewhat like big and very expensive. And we want our device to be, of course, very small, plug and play, and not expensive, because we want the woman be able to buy it, for everyone. So cost for us is really a key challenge that we are working on, of course.
Okay. And yes, sure.
No, I think generally in women's healthcare innovation and femtech, maybe the largest challenge, even more than regulation, which is terrible, is the reimbursement. And I think the last year is really, we're seeing a great change. What we're seeing is the change from, until now, it didn't matter if it would be B2B or B2C or B2B2C, whatever. In the end of the day, you'd be asked, what is your reimbursement code? And what we're seeing, and it's beyond the women's healthcare, what we're seeing with, for example, Pepe Health providing a subscription, which no more need for payer, no more need for insurance companies. I think we are observing a great change that will change the business model and will create great opportunities for companies such as those in this panel.
Okay. And Helen, do you have any thoughts on that, since your company is more in the wellness area?
Yeah, it's I really like your point on the coverage, because a lot of things are considered prevention, and insurance don't typically cover prevention, because their thinking is still that covering something that is tangible is what insurance do. I hope and I think that there might be a shift, because if you have a preventative approach, then basically you have less cost afterwards. But indeed, we are very much in a preventative world, which is like, how can you be healthy today? How can you increase your immune system? And we really had an uptake with COVID, because women were really conscious about the fact that being healthy today was important. But when it comes to insurance, like we're still not there. And also when you look at things like, if you have lower back pain, it's called health. If you have menstrual pain, it's not called health. And if you have anything around fertility, it's also something that is very much still in the women's world. Like men are not, it's not considered like, like you can see it with paternity. If you have 2 weeks of paternity, that's literally saying like it's a women's issue. Like men are not part of this thing, which is called like having kids. And like they can't really take time off to go to do the scans and things like that. It's literally a woman's issues. So I think we are still like, there's still so much work to do in that. And we are, to go back to your question, to the cost, we are direct to consumer, which has its challenges, because it means that a lot of work questions, a lot of the things that are important for us is how do we market it to them and how to reach them. We have a very strong voice. So like we also saying, like the whole messaging around like women being weak and fragile, it's actually not true. Like women have never been weak and fragile little beings. They are like these incredible, like very fine-tuned machines that every single month can have a baby from like scratch, basically. So the whole body is able to do that every month. And women can work while having a child, while exercising, while doing all these things. So like, how do we switch the messaging of that? But so we are definitely B2C in that sense, but we do have a B2B angle, which is a research angle. So by opt-in only, obviously, you can do research. So if you want to trial a new methodology or a new drug or a new supplement or things like that, you can by opt-in have women buying into it, and that would have a cost.
Right. And another question that anybody who feels like it can take. I was when I was coming here, I saw a horrible advertisement for a Femtech product that had a very big close-up of a private part. And I was wondering, it made me wonder what you think are the best practices for advertising Femtech products to the customer and marketing, if there are things that do's and don'ts and maybe things that are counterintuitive. Who wants to take that? Anybody doing advertising?
I can jump in. So I think it's actually really interesting. I think that's because we are in this nascent market, there's a lot of extremes. But I think one thing that I've seen that is actually really interesting is on Instagram, these walls are like vagina walls, which should be called vulva walls, but it's like having, because everywhere where you've had education, sexual education, like the only thing that we've been educated on is it looks like a little girl genitals. There is no, like, there's like perfectly like shaped, and the labia is like non-existent. And so basically women do not have an understanding of what is a normal body. And if you go into porn, obviously, like, it's also very distorted as a reality. So although like it is like we're going to an extreme, perhaps in really showing a lot, I also think that there's a huge educational aspect that is needed around even like, I mean, some of the things that you are doing on the panel, like looking at the cervical fluids, a lot of women do not know at all that is absolutely normal to have that, and it's changing over the month. So a lot of education should be done on that, perhaps at school, but perhaps as well in advertisement, because there hasn't really been a place where that has been shown.
Anybody else want to talk about that?
We didn't start, of course, to do any marketing because we are early stage, but when I speak to women, it seems like natural, and I don't feel there is any specific things to you don't have to say that, or it's very natural. You explain the pain, everyone understand, women understand, and I don't see any specific kind of things that we won't have to do. I mean, my background is marketing, and I feel it natural to speak about something which you need, and that's it.
Mm-hmm.
I think that social networks do a lot of good because in closed groups, women feels more comfortable to talk about problems and share and show other women that they are not alone in these situations. And then they're spreading the rumor about good treatments, good doctors, good options for healing.
Thank you. So our message is enabling women, and we aim to have these tests done at home because it's so easy to collect secretions like doing the COVID test. So our marketing approach, and again, we're far from the market, 2 years, not that far. Our main message is empowering women. We don't have to use all these provocative pictures, but the message is a happy and a woman with less concerns. So I think it's all about the approach, if you want to do a provocative picture or not, but the message is clear.
Do you think there's ever room for, like, I don't know, provocation or?
My personal belief is no.
Mm-hmm. Yeah.
I wouldn't use, we understand the need, we don't need it. We don't need to draw attention using, not for men's body, and also not for women's body. It does, I think it takes out it really takes the attention out from our message and does the opposite, to my opinion.
Yeah. So I'm wondering if you can tell me a little bit about your conversation with the doctors. We talked about the investors, we talked about the consumers, and in previous conversations that I've had about this subject, there was some talk about how the doctors are very fused with their big pharma partners, and maybe they are kind of very used to and very comfortable with the solutions that they're getting from big pharma, and suddenly a whole host of other companies that are smaller and like act very differently are coming in and like kind of changing the conversation. So I'm wondering if you felt that, and how your conversations with the doctors are going, and what you would like to change in their perspective?
I think the first feedback we received is that physicians won't be happy or willing to hear about our development, but the opposite is the truth. Physicians lack tools and they're looking for new tools. As soon as we prove clinically that we're valid and we're better than what's basically not out there in the market in terms of ovarian cancer, they're very happy to listen. In Israel, in the UK, in the US, people tell me, show me your results. I need your tool to save women. So we have the same goal and they're very open for innovation. And it's comforting and very happy to hear about that.
Yeah.
I should say the same. Each time we speak with a physician, head of department, any physician, we all say, wow, where were you before? It's like, yeah, it's a great approach. We want to use your tool. Are you ready? When we can start? No, really, it's like, wow. And each time, we speak with a doctor, we think perhaps he won't like it because we are asking him her to say, okay, the woman will do her scan and blah, blah. That's the contrary. We say, wow, of course, we have to prove the quality of the image, that what we're going to provide is an image as the same quality of the image which is provided right now with the machines at the clinic. But if we prove that, and that will be, yes, they are really, really open to that. Very.
Well, I think it's regional dependent. Most gynecologists we talked with actually admitted that there is a problem, that they misdiagnose in half of the situations, and that they need this tool. Actually, in the UK, the first choice for a symptomatic woman is to see a GP. And these guys, they just don't like to admit that they don't know how to diagnose, although they solve it as this is trash, use antifungal cream, and that's it. And they are doing more mistakes than gynecologists, but they won't admit it. So I would say it depends on the region and how honest the physicians are with themselves.
Okay.
I just want to quickly just add there, I think pharmaceutical companies do move quite slow. Yes, they have the capacity and the funds to potentially disrupt this space, but startups move a lot faster. And what we found is, a lot of physicians are actually more willing to actually work with us and help shape the product and, the development of the product as we go along. So we haven't seen that issue. And I think a lot of people are willing to try something new, with regards to a medical product that has been validated in some respect. But, we onboarded our chief medical officer at the very start of our journey, and it's been kind of instrumental for us to gain traction within the public healthcare system as well.
So I think,
If I could just please add something about the other side of how it seems from our side when we meet companies. So, and I think I met with 2 of the companies and I'm waiting for the 3rd. And I think that one important thing is it's really important to pivot the presentation or the deck or whatever, which is different when you meet the physicians than you meet the VCs, because when someone's developing, I don't need to hear about the need. If you need to persuade us about the need, then there's a problem with the company. And what we want to hear, and we want to hear about it much more than the VC, is will it be working? Is it safe? And I think that's the first thing. And the second thing, which is really important to setting the stage for such meetings, is to be clear from the beginning what stage the company is. Are you talking? Do you have a good idea? Do you have an idea and you want to check with us if you should invest in it, or do you have a product and you want to collaborate?
Okay, so I think we'll take questions from the audience now. Anybody want to ask?
Working only on that.
So that's a really good question. So, we must say something that is really sad about all the VCs, and I'm looking at some, but it's not only Arkan. So many of the so-called medical VCs, they call themselves medical, but they really want is digital, which in many times, and I'm sorry for saying it, but many times when they say digital, they mean something that doesn't have too much clinical impact, which may have all kinds of regulatory hurdles and risk, all kinds of reimbursement risk. They want something digital. So AI for them actually is much more appealing than a medical device. And it's true. You know, I'd say one more thing. There's I think a very cool medical device. We want to start developing at Sheba now. And we have a great CTO that wants to join us. And I told him, okay, before we re-embark on before we start the journey, I want to put online, we called one of my friends in Lionbird, which are very cool VC. And I told her we want to do this and that medical device and what we want to do. And she said, yuck. Because I told him, okay, if you want to do it with us, we're going to succeed. But remember, we're going to have a really tough time with VCs because what they want is something digital. And for us, it's the opposite. We want the impact, and we want more than only AI. AI being a component, but not the whole story.
Do we have time for another question? Okay. All right. So thank you very much. It was very interesting, and good luck to everybody.
I'm very happy to have here today for a virtual fireside chat, Mrs. Betsy Blutson from Procter & Gamble. Betsy is a Senior Director for Scouting and Partnership at Procter & Gamble Ventures. Hello, Betsy.
Hi.
Thank you very much for accepting our invitation and being here with us today.
You bet. Thanks for the invitation.
Talking with an enterprise your size, the first questions come into mind is, what is your strategy regarding femtech, women's health, and is there any specific topic that you are focused on?
Yeah. So, P&G works across the femme wellness business, right? So we have lots of different businesses that are targeted at and speak to women. Within P&G Ventures, which is the space where I specifically work, we are working very hard on menopause. This is just a fascinating category from so many different perspectives, but we stood up a brand called Kindra in this space a couple of years ago. I think the data is something like by 2025, there'll be over 1 billion women that will be postmenopausal. And even with the increases in femtech investment that have happened over the last couple of years, only 5% of that investment is going to this menopause space. Almost everything is going to reproductive health. And so as you look at the growth and a market that is expected to be over 22 billion by 2028, there is a huge opportunity to innovate in this space. And so it is, I'd say from a venture standpoint, the first place that we're focused on femtech.
As you mentioned, unfortunately, still the entire femtech category is overvalued, sometimes even overlooked. Why is that? And in which way you think a P&G strategy can actually change it?
Yeah, I mean, I think it's a complicated problem. And so we are working very hard to drive visibility to the issues that plague women and to drive awareness. We are over 50% of the population, and our problems need to be recognized and understood and solved. And so, one of the first things that we are doing is really driving that awareness. The second thing is, well, anyone can solve any problem, and we know that is true. The truth is that oftentimes founders solve problems that are most acutely painful to them. And so in a world where only less than 2.5% of all venture funding goes to female founders, you've got a bias that makes it really difficult to have femtech innovation make it to market. And so, we are doing our part. We are expanding our networks in every way that we can to make sure that female founders
any founder who's working in the femtech space, but especially female founders, know what our grand challenges are, what it is that we are looking for. We are reaching out and making those connections to try and figure out if we can partner together and create a world where women have equal access to venture building resources and capabilities that everybody else does.
Last question to conclude our discussion. I want to hear your personal view. Why do you think now it's a good timing to invest in women's health?
So I would tell you that if the raising of our seed round for our Kindra business, which is the menopause business that we stood up a couple of years ago, is any indication, I would say that investors are taking note that this is an area that is hot. I also think that there is an intolerance from women today for the lack of solutions to the things that hold them back. 59% in the menopause space, 59% of women say that it's having a negative impact on their ability to work. Right, we got to solve that problem. So the combination between the right thing to do, women have had it and are looking for solutions, means demand, and demand means revenue, and revenue means good investment. So I think, when you connect all of that together, the time is now. Yeah, this is an economic imperative. And again, while I've been talking mostly about menopause because I'm really focused on that, across the femtech space, there is opportunity and issues that need to be solved. So we're bullish on it and incredibly focused on making a difference.
Thank you very much, Betsy. I really enjoyed our discussion. I think it's only the beginning. There is a lot to do in the femtech space, but I'm happy to know that an enterprise like P&G is really very passionate about it and also committed to make a change. Thank you very much.
Thank you.
Fine. Good afternoon, everybody. My name is Sam Cronin. I'm the Digital Health Investment Manager at Arkan Holdings. For those of you that aren't familiar, Arkan Holdings is Israel's largest private healthcare investor. We have about $2 billion under management, covering most points of the healthcare value chain. It is a pleasure and an honor to be here today and to be moderating the discussion on building the femtech ecosystem. I would firstly like to apologize that Karen Leshem of Ocon is unable to make it today. Unfortunately, she's had a family incident and won't be able to join us. So I just wanted to cover that one. Rebecca, would you like to introduce yourself?
Hi, my name is Rebecca. I'm a co-founder of Aquafit Intimate, and I wanted to thank Procter & Gamble. They awarded us the Innovation Award in March of this year for our sexual wellness gel stick.
Thank you very much. And then we'll just go clockwise from my view. So Evie, if you would please introduce yourself.
Great to be with you, albeit virtually. I'm Evie Mulberry. I'm managing partner at the Astia Fund. At Astia, we invest in high growth companies that have at least one woman in a position of equity and influence. We invest globally. I'm based in the UK. My colleagues are in the US, but we invest globally. We have a global portfolio, including Karen of Ocon. So we have one Israeli company in our portfolio. We invest across all high growth sectors, but have had a number of successful companies within the women's health space within our portfolio, and we invest across stages. So I'm one of 4 partners deploying the fund. The fund focuses on Series A and Series B, but it's not the only investment activity at Astia. And pleased to be joining you. Thank you, Sam.
Thank you. Alexandra?
Hi, I'm Alex Richardson. I'm a partner at Taylor Wessing, which is an international law firm with a particular focus on the tech and life sciences space. I personally am based in London, and I advise companies and investors in tech and life sciences across the life cycle of those companies throughout. So from seed through to as far down the alphabet as you care to go, and hope that I can give some useful insights on investments in the London market and internationally, as we're seeing investors increasingly diversify where they look for their opportunities.
Thank you. And Karina?
Hi, everyone. I'm also dialing in from London. I'm a co-founder at Femtech Lab, which is a global accelerator for startups in women's health and wellness. We work with companies that are early stage but have a product in hand, and we take them through a 3-month program where we bring together mentors and advisors such as Evie here on the line and Karen Lisham that wasn't able to join. We introduce them to our startups, help them accelerate their growth, and then we culminate with a demo day where we introduce them to our investment partners. We also have a media brand called Femtech.live, where we bring a broader awareness about the sector and about women's health to a broader audience beyond our little Femtech bubble.
Thank you. I'll say to those of you coming in from London, since we're running a little bit behind schedule today, put simply, we're kind of going to wing this conversation. So just be prepared for that one. So Evie, if I can begin with you, from an investor angle, why do you think that now is a good time to invest in Femtech, and what convinced you to invest in Ocon?
Yeah, I think it's a really exciting time to be investing in Femtech. As Betsy said, I think there's increasing spotlight on it. It's a really hot area, but we've been investing. And in fact, our first investment as an investor in 2012 was into a women's health company. So we've been investing in the space for a long time. We have a lot of conviction, and it obviously plays a part in terms of the world that we want to see, where women's health is equally addressed. As investors, it's the type of world we want to be seeing. And so not only the investor returns is really exciting, it's sadly it's still an underfunded space, but as an investor that kind of makes you quite excited, because you know that you can find some really good investment opportunities. 2 of our largest exits have actually been in the women's health space, and Envision sold to Boston Scientific, and then Alydia Health sold to Organon earlier this year. So 2 really exciting investments that we've had exited in this space. So it makes us as investors hugely excited to continue our focus on it. We do invest across all high growth sectors, as I mentioned, but particularly women's health, we see that untapped need and certainly an opportunity to make a difference in the world. And then why Ocon? It's the first Israeli company that we invested in, but really exciting to see Karen as a lead. It's a shame that you're not getting to meet her today, because she's a force for nature. And it, in terms of as an investor, we always look at the team and particularly the CEO. So Karen's extremely experienced, but extremely credible as a leader. She's got a really good team around her. And so that's first and foremost, Karen and herself as a leader in the business, but also the innovation itself and the opportunity that the company brought about to us. And in terms of I don't know if you know what the company does, but it's women's health product. They develop women's health products, all based upon their intrauterine platform, which is a 3D concept. So it's very different. It's and their first product to market is contraception that involves no hormones. So, but that's just their first product to market. So something that really excited us as investors was the fact that they have multiple applications, and it's obviously within a huge unmet medical need within women's health. So really excited about the innovation that they're bringing to market. And of course, the opportunity, having highlighted our 2 recent investments and exits, it's a space that we get excited about, and as investors, when we don't shy away from, and we've got a track record of working out how to assess opportunities in women's health space. I'm really excited about it, and excited to have our first Israeli company in the portfolio as well. Looking forward to many more.
Fantastic. And Karina, why did you choose to found the lab, and how did it influence the Femtech ecosystem in the UK?
Yeah, sure. So actually, my co-founder and I come from multiple different tech sectors, fintech, legal tech, reg tech. So we've seen, and we've worked together in the past in building brands and launching products, and we've seen how sectors emerge and then kind of grow into quite productive markets and ecosystems. So it was interesting when I came across Femtech. I mean, of course, things click for a lot of women when they discover Femtech, because how can you not be instantly passionate and excited about all the innovation happening in women's health? But also it became very apparent that it's a huge opportunity. And I think a lot of the conversations earlier today were about how much of an opportunity it is. But what we instantly saw is also an opportunity to build an ecosystem. And usually in a tech sector, when it's first emerging, you need accelerators, you need capital, and you need to promote that sector and what entrepreneurs are doing. And that's how the idea around Femtech Lab came together. And that's exactly what we're ultimately building. So to kind of answer your question, why we decided to set up Femtech Lab, on one hand, it's just this passion for the sector, of course. And on the other hand, it's seeing an opportunity to build this breeding ground for early stage companies. And to answer your second question, even though we are based in London, we're really aiming to build, and we are building a global ecosystem for Femtech. Being headquartered in London, of course, has created a little bit of an epicenter here. We're starting to run in-person events. We're educating more and more investors in the space about women's health innovation, about the fact that it's not just reproductive health, about the opportunities in it. And it's making an impact, whereas now it's honestly very, very rare when we speak with London, UK-based investors, and even sometimes European, that they haven't heard about Femtech or that they think that it's a niche. And we actually have a lot of inbound now from the investor community in the UK and in Europe wanting to meet the startups that go through our program and attend the demo day. So just creating that awareness has produced an effect that is quite positive.
Sam, I just echo what Karina was saying about from an investor perspective, because I know that you have many in the audience there today. For the companies that go through the programs, I am biased, I'm one of the advisors to the program, but the quality of the companies that go through these programs is phenomenal. So if you're an investor sitting in the audience, you should get in touch and make sure that you have an invitation to the next demo day, because it's a really exciting group of companies.
Thank you, Evie.
Mm-hmm.
Thank you. Alex, what do you think that investors look for when they're looking for investments in health tech and in femtechs, specifically? You have this very broad exposure from your position.
Yeah, so I mean, for the most part, it's the same challenges that a lot of, all tech companies will face, and investors are looking for the same things, a clear idea of how you're going to monetize your product, what your roadmap is, and a well-organized business and a great founder team to get behind. I think the additional challenges that are faced here are around regulation and needing to have a good understanding of what regulation will apply to your product or your offering. Because in health tech, obviously that is a key concern that doesn't apply to many of the technologies. And so investors will be all over that to make sure that that's fully covered. And also on data protection and security. It sounds a bit boring and legalistic, but you're dealing with all of this healthcare data. It's very important that you've got the correct processes in place, because if you have an issue with that, that could really bring down a company and therefore the investment. So it's, as well as having a clear idea of your product and where you're wanting to take it, it's making sure that you've got the good foundations to give investors the comfort that they need to put the cash in.
Thank you. Evie, if I could ask you one more, and then we'll flip over to the founder side, the entrepreneur side. How is investing in femtech different from investing in other spaces, whether in healthcare or sort of, more general tech? But what are the distinctions and differences you notice with investing in femtech?
Yeah, I mentioned that we've got very comfortable about investing in the sector, and whether you call it femtech, women's health, whatever the label, but I think you have to get comfortable with the terminology that you're going to be using in the room and in the conversations. And we are very comfortable at Astia with that terminology, but I see when we're syndicating deals with other investors that not everyone's on the same page. You have to be able to use the word vagina in a conversation and be comfortable with that. So I think you just have to be bold. And when you get to Rebecca, she is completely comfortable and confident about talking about it, but it is different, but we spent many years getting comfortable and being very excited about the space. And as I said earlier, it's an underfunded space, so as an investor it makes me very excited, because I think you can get some really interesting investment opportunities. Sadly, it's an underfunded sector still, but thankfully things are changing and we're seeing it change at quite a pace. So it's very exciting. But yeah, just getting comfortable with the uncomfortable is what I say to other investors in the room that are looking at entering into the space. We're all grown-ups, right?
Rebecca, do you want to chime in with your experiences on that one?
Yeah, well, from an entrepreneur's perspective, first of all, we're an all-women team. I have a history of 25 years in entrepreneurship of many other things, and never have I heard so many people terrified of sexual wellness. We won the Procter & Gamble Award in March, and even Procter & Gamble, who's pushing this space, looked at our product, which is a wellness product. It's a vaginal gel stick, a woman self-care. And they were like, you're really speaking to the vaginas and you're speaking to women. We want to look at you in 5 years. Good luck and bye. And this is really interesting because we are not a medical product per se, but we are actually educating women about medical issues. Many women spoke here about menopause. Sexual health is something that connects women from when they're very young, menstrual cycles, through fertility after giving birth, and then menopause. And a lot of time that connection isn't being made and education isn't being made. So what we're seeing is we don't feel that anybody is comfortable with this. We feel that doctors are not comfortable with this. You recorded that 50% of doctors in the US don't even speak about menopause to their patients. So doctors are not so comfortable with this because it's not in their space to make somebody feel better, or vaginal dryness or painful sex is not their core business. Women are uncomfortable speaking about it. I've spoken about this to some participants in the audience. We have 2 buttons on our website. One button, speak to us, one button, speak to a doctor. We're seeing 20-fold turns to us versus turning to a doctor. And part of that is because women don't know what to ask and when to ask and feel embarrassed about the whole thing. Why should a woman feel embarrassed at 52 that she's having painful sex is beyond me. I would even go further back. A woman who has cervical cancer is somehow embarrassed that she has HPV. I mean, HPV is, if you've basically had sex, you have HPV at some point, 85% of the population. And so that's the women's side. And then we've got the investor side, and the investor side is like, yeah, vagina is 50% of the population. Okay, is there a market there? So we're not. I mean, we're very, very optimistic. I also want to give you the other side of it, the overly politically correct. Google blocks anything. If a woman types in painful sex, they categorize it or flag it as pornography. We've had discussions with Google themselves, showing Google that, in fact, a woman who complains about vaginal dryness, if you like, just you say it, is called atrophic vaginitis. No woman in their right mind knows that vaginal dryness is atrophic vaginitis. And we show them the differences in searches, like the number of searches for atrophic vaginitis and the number of searches for vaginal dryness, trying to persuade them that they're blocking all these women from getting care. So we're not pessimistic, but we're not seeing anybody run to invest in this huge market. I do think what's also interesting is that we're taking upon ourselves as this teeny startup. A lot of the things that we saw in the first lecture, presentation, which was brilliant. We are going direct to consumer. We are educating women directly. We're also listening to women. We've developed a conversational interface that, a little bit differently from K-Health, which is top-down machine learning, we actually offer up bottom-up. So we're also listening and learning from each of our women. So we're direct to consumer, sexual health, menopause. We already got 3 strikes against us. And we're trying to make a go of it. It's hard to tell.
So let me ask you, what would you recommend to the next generation of founders in this space?
Wow. Don't think too much when you found. That is, don't think about it. Don't get upset when you meet investors and they're all about sort of hockey stick growth, and when they're willing to invest in a company that loses billions of dollars before they show income, and they ask you, can you show us profits, and what's your go-to-market strategy? It's okay. I think it's also really, having been involved in tech in so many spaces, this is really the first time that I engage women emotionally, it is so satisfying in that sense. I mean, we're getting SMSs at 3 o'clock in the morning, almost too much information. You saved my marriage, you saved my sex life. And it's like, so at that level, I have never worked on a product and a service that has had so much personal impact. And that's what keeps us going. So if we impact 2 women a day and it becomes 3 women a day and it becomes 100 women a day, we'll be very, very happy. But I stay on the financial side, it's a shitstorm.
Thank you. I appreciate that. My next question I'm going to address to all 3 of you in the UK, please. I want to say feel free to jump in and address. I think we might need some sort of, order, otherwise you'll all 3 start speaking at the same time. But from your perspective, what is it that upcoming founders need to do to be more investable and viable?
Shall I jump in?
Go for it.
Please.
Yes, that's a fundamental question for us as a business, because our customers are founders and startups. We're building a product for them. So we spent a lot of time asking that question of founders. And there was something, I was talking to a few founders from Y Combinator a year ago, and I asked, what is it that you need? What is it that an accelerator or an ecosystem needs to provide you to add value? And one of them said something very sharp, and it still stayed with me. He said that entrepreneurs need access. They need access to capital, and they need access to really good advice at the right time. And it still is in my mind. It's still a little bit of a focus point for everything that we're building, is providing entrepreneurs with access. So it's capital, very much so. Some of the most productive ecosystems have a very good flow of capital and investment and angel investors and later stage investors. So that's definitely important. Access to different organizations that can give startups advice. And I also think that there's something interesting in health tech and femtech around the fact that there's still scientific research happening around women's health and wellness, and a lot of new information that's coming in that if entrepreneurs had access to it, could turn into business opportunities. There's like this interesting flow because there's so many problem areas that are underserved, largely because there's not enough research and understanding of what's happening in the woman's body. So kind of connecting science and technology and entrepreneurs is also something I think femtech founders and early stage entrepreneurs could benefit from. And another aspect that we see entrepreneurs struggle with is marketing and what they often call growth hacking. It's become very difficult with building direct-to-consumer products to market them, build an audience. It's become very competitive and people's attention is very scarce. And it's become expensive to acquire customers. So doing that effectively, quickly, rapidly is a challenge that also we kind of try to help them overcome.
Alex, Evie, do either of you want to?
Yeah. Go ahead, Alex.
Sorry.
Okay.
Building on what Karina said, really, I think making the most of and being as involved as possible in the ecosystems that are there. I appreciate this area is still growing and it can be more difficult to form those networks. But we've seen just from this discussion today that they are out there, and there are many other ecosystems as well that you can sort of get plugged into. I really can't overstate the benefits that can have for founders. That helps you with access to capital, understanding it's not just VCs, there's other ways to get cash, how other people have gone about growing their business, and that sort of mentoring side of things. The more people get involved, the faster the ecosystem will grow and the more beneficial it will be for everybody in helping them grow their business.
Yeah, I think one point I just quickly make before I go on, but is that I really feel that women don't need to be fixed. Like the pipeline of exceptional women, you have them in the room there today, but also that we see day in, day out at Astia, is that they're phenomenal as they are. They don't need improving as an entrepreneur, and they don't need to be fixed. And I think when we look at the inequality of funding, not just in this sector, but for female entrepreneurs in general. It's down to the ecosystem. And so it's down to people like me and as an investor to make sure that I am open to seeing opportunities that are from female entrepreneurs. And I think, so what I'm going on to say is very much, I don't feel that women need to be improved, and I don't think they need to be fixed. But we as an ecosystem need to do a better job of making sure that capital flow and expertise, but also capital fundamentally flows to those companies. And so I'll get off my soapbox, but and then two things that I would say is that's really helpful for me as an investor in this space is to have a really easy translation from an entrepreneur as to where they are at the moment in terms of product market fit. So any proof point, even if you're at a really early stage, any proof points that you can show me that indicate and validate product market fit is just really helpful for me to kind of understand where you are now and where you're going. And also the translation of a credible regulatory path. Alex alluded to it as well. Even if you're at the very start of it, just to know that you understand what hurdles you still have to go through. I'm not afraid of investing in companies before they've got regulatory approval, but I do want to know that you understand the steps that are ahead of you and how that you'll go about going through those. So a really clear, credible regulatory plan is helpful for you to be able to translate to me as an investor.
Thank you. I'm going to skip to my last question. I'm very aware of time. Also, I think Rebecca has to get on her way. So Rebecca, perhaps I'll begin with you, but if you could change any one or three things about sort of the Femtech investment ecosystem, what would they be? Essentially, how do we, as a collective, as a community, take it from what it is today to what it needs to be tomorrow?
I think it starts with awareness, because I think that everybody in this room is maybe aware of the issues in the space, but I don't really think people are that aware of it. And I also want to say that I love the comment about not needing to fix entrepreneurs. I get lectured every time I meet an investor. I get lectured about what I should do and why I'm doing it wrong. And it's very interesting because I was not lectured in my previous companies that had to do with other areas. So I think that the first thing is awareness. And the second thing is being open to collaborations, because sexual wellness is in between health and wellness, and it is really a spectrum. I think the most interesting thing that we can contribute as entrepreneurs and that investors need to be aware of is the power of entrepreneurs in this space of speaking to women. I think that our biggest asset at Aquafit is that we're hearing a lot of women, and we're hearing them because nobody else is listening to them. And I think that this is a huge, huge asset. And this is where entrepreneurs, we're not doctors. We don't claim to be in the medical space. We're in the wellness space, but we do have conversations that typically investors don't have, and doctors don't have with users, and that's something that's very new.
And then we'll just take it round. Sorry, Evie, Alex, and then Karina, please.
I'd like to see increase, the continued increase of female investors, the check writers, and on the other side of Rebecca's table. And I think the data is quite clear in that when you have female check writers, more women, but also in the sector, more capital flows to those companies. So I'd like to see increase of female check writers like me at the table within the sector. I think it'll transform the amount of capital that flows to it.
Yeah, I agree with that. I think, the ultimate aim has got to be to have every business judged solely on its merits and with no bias against products that are focused on women. And how we get there, I've got to agree, has got to be more women in decision-making positions within VC.
Yeah, I agree around awareness and more female check writers for sure. We also noticed that a lot of funds or investors, they're tapping into the space, they're kind of still forming their investment thesis, so to speak, or how they look at the markets and how they want to make bets on that market. So the sooner we have kind of maturity happening around that across investors, I think the faster the check writing will be. And I just wanted to say, to echo what Rebecca was talking about, my background is product. And when I came into Femtech space, I was amazed at how women build products, how much they understand, with how much compassion and empathy they understand their end user. This is 100% a thing. Women obsess over the end user in a way that I've never seen fintech founders obsess over their users. And what's interesting is that one of our investors, if you see that invested in Femtech Lab, said that there's a certain virality element to the femtech sector. If you build a product that your customers love, which we see founders obsess over, so if you build that, the marketing that you need to do is minimal, because when women find something that they love as a segment, they recommend it very actively to everyone they talk to. So there's this certain virality about the sector, which is another thing that's amazing about femtech, another thing that makes it an incredible opportunity to invest in.
It's very interesting. Thank you. I think we'll wrap up there on the discussion. Do we have time for a question or two?
Well, I couldn't less agree regarding having more female investors. This is one of NEOME's main ambitions and goal, but still, unfortunately, the wealth in the world is male dominated, and I would like to see more investors from other VCs and other places in the world also join the femtech and invest in femtech, and see femtech as a valuable investment vertical. And I think also one of the main goal of our event today was to enhance the collaboration between the UK and Israel. And I think you mentioned it, Evie, and also Karina, and I think really if we as investor or as passionate about the femtech will work together. If it's on investment, if it's to open doors to companies, to help them to find the relevant designer partners, first customer, I think this will also will support the growth of femtech in general. So I really enjoyed the discussion and hope that we'll succeed to build effective ecosystem together.
Absolutely. Thank you so much.
Thank you. I think we'll stop there. Thank you very much, Evie, Alex, and Karina. And thank you very much, Rebecca. I'm going to take this opportunity to thank you for Ronit and Dorit and everybody for being involved. And I'm going to hand it over.
Thank you all very much for coming. I'm not going to speak long because we're all hungry and it's been a long day. But thank you all for all the guests in the UK and everyone that came and all the moderators. Obviously, we couldn't have done it without you. So thanks all. Please feel free to come out and have a bite to eat and network. Thank you.
By the stage.